Another big story this year has been that the diagnosis of ear infections in children is on the decline. We brought you that story in April with the help of the specialists at Lake Ear, Nose and Throat.
Ear disease is still quite common in younger children. Despite the pneumococcal vaccine, these children still are at risk for ear disease. It's estimated that 80% of children will have one ear infection by the time they're 1.5 to 2 years of age. What becomes an issue is when the fluid that accumulates behind the eardrum doesn't drain normally, the fluid accumulates back there and hearing loss develops. The issue becomes the child will develop kind of a silent type of hearing loss where they won't complain of pain, they won't be running a fever, but they'll have what we call silent hearing loss. And in a young child, it's very difficult to determine what that might result in. But in terms of the middle ear disease, which is the more common of the two, a silent hearing loss, the child listening to the television too loudly, not following directions appropriately, seeming like a difficult child, but really just not hearing well, that would be the kind of thing that a parent would be looking for. Certainly if a child has infections, fever, pulling on the ears, irritability, that would indicate that there would be maybe an infected type of fluid behind the eardrum as opposed to a silent fluid that's more difficult to determine. Children do usually outgrow their ear disease, but it can take until they're 5 or 6 years of age. The anatomy of the ear, the anatomy of the nose, the back of the nose, those areas can be kind of crowded. Some of the difficult things in diagnosing and treating a child is they don't necessarily tell you what's bothering them. So you have to be a problem solver. You have to kind of dig under the surface and ask questions to the parents and try to get the information from them to try to make the diagnosis. And from an examination standpoint, sometimes they're little wiggle worms. They don't really hold still too often, but most of the time they're pretty cooperative.
For more information about Lake Ear, Nose, Throat, and Facial Plastic Surgery and its treatment services for children and adults, follow the Ear Infection Trends story link on our homepage, yourhometownhealth.com.